today, we're going to unmask a condition that, believe it or not, hides in plain sight, slowly, almost imperceptibly changing a person's appearance over years. It's called acromegaly, and it's an endocrine disorder whose effects are just as profound as they are gradual. So let's just jump right in with a little bit of a puzzle. What could possibly connect symptoms as different as your hands getting bigger, these persistent headaches that just won't quit, and suddenly snoring like a freight train? I mean, they seem totally random, right? But they can all be clues pointing to one single underlying diagnosis. And this is where the mystery really begins. Acromegaly is, well, it's a master of disguise. Its first signs are so subtle, so sneaky, that they're often just brushed off as, a normal part of getting older, or maybe gaining a little weight. The very first clues are really personal and super easy to ignore. Maybe it's a ring that you've worn for years that suddenly doesn't fit anymore, or you find yourself having to buy bigger and bigger shoes. The changes are so slow, happening over months and years, that the full picture only really snaps into focus when you compare a recent photo to one from a decade ago. And let me tell you, the difference can be absolutely shocking. So, how in the world does a doctor solve a puzzle like this? Well, like any good detective, they start by gathering all the clues, building a clinical picture piece by tiny piece. And the range of symptoms is just staggering. I mean, look at this. On the outside, you have these really visible physical changes. Hands and feet getting bigger, a jaw that starts to jut forward, coarser facial features. But internally, all that excess growth hormone is just wreaking havoc. It can lead to things like diabetes or affect fertility. And then you've got these widespread issues: heavy sweating, sleep apnea, painful joints. Every single one of these is another piece of the puzzle. But out of all those clues, one is incredibly specific. It's called bitemporal hemianopia. Yeah, it's a mouthful, I know. But it basically just means losing your peripheral vision, kind of like you're wearing horse blinders. What makes this such a powerful clue is its location. See, this specific pattern of vision loss points directly to pressure on the optic nerves, which happen to sit right next to the pituitary gland. It's a huge tell. Okay, so with all these clues gathered, we can now move from the investigation phase to the big reveal. This is where we use specific tests to definitively uncover the diagnosis and say, aha, that's what it is. So with all these signs pointing in one direction, how do doctors actually confirm it? Well, the whole investigation funnels down to one single, incredibly powerful screening test. And that test is for something called IGF-1. Here's a way to think about it. Growth hormone levels themselves can bounce around like crazy all day long, but IGF-1 levels, they're much more stable. The liver makes IGF-1 in response to growth hormone. So if growth hormone is consistently high, then IGF-1 is going to be consistently high too. That makes it the perfect, reliable marker for this disease. A high IGF-1 level is a huge red flag, no doubt. But to be absolutely certain, doctors use this really clever follow-up test, the oral glucose suppression test. Here's how it works, and it's actually pretty elegant. Normally, if you drink a sugary solution, your body goes, whoa, lots of sugar, and it actively suppresses the secretion of growth hormone. It's a natural feedback loop. But in someone with acromegaly, the tumor that's pumping out all that GH is basically rogue. It doesn't listen to the body's signals anymore. So even after that glucose drink, the GH levels stay high. This failure to suppress, that's the smoking gun that confirms the diagnosis. So we've confirmed it. There's way too much growth hormone. The next logical question is, why? What's the culprit? What's actually causing this massive overproduction? And here it is. In the vast majority of cases, it's a benign, and that means non-cancerous, tumor on the pituitary gland. It's called an adenoma. You can think of this tumor as a rogue factory, just churning out all that excess growth hormone, 24/7. To find it, to see exactly where it is and how big it is, doctors will order an MRI of the pituitary. All right, we've solved the mystery, we've identified the cause. Now we get to the most important part, the solution. What's the path to treatment? The game plan for treatment is a pretty clear 3-step process. The first line of attack is almost always surgery to remove the tumor, which, and this is pretty amazing, is often done right through the nose. Now, if surgery isn't fully successful or maybe not possible for some reason, the next step is medical therapy. And then radiation is kind of the final option, reserved for the really tough cases. When it comes to medication, doctors have 2 really clever ways to tackle the problem.
The first type, somatostatin analogs, are basically like sending a stop signal directly to that rogue tumor, telling it to slow down production. Sometimes they can even shrink it. The second type, GH receptor antagonists, act more like a shield. They block the excess growth hormone from actually affecting the rest of the body. So the factory might still be overproducing, but this shield prevents any more damage.
But at the end of the day, treatment is about so much more than just numbers on a lab report. The real goal is to get those hormone levels back to normal, sure, but it's also about controlling the tumor and, most importantly, reversing the symptoms to give a person back their quality of life. A diagnosis like this is definitely life-changing, and managing it doesn't just stop with surgery or the first prescription. So let's take a look at the road ahead, at what long-term life with this condition is really like. Living with acromegaly means you have to be vigilant, always on the lookout for potential complications. The treatment itself, especially surgery and radiation, can sometimes damage the pituitary, which leads to a condition called hypopituitarism. There's also a higher risk of things like osteoarthritis and colonic polyps. And if left untreated, the most serious risk is increased mortality from heart conditions. And there is one rare but absolutely critical emergency to be aware of. It's called pituitary apoplexy. This is when the tumor suddenly bleeds, causing an explosive, worst headache of your life kind of pain. It is a true neurosurgical emergency and requires immediate medical attention. Now, after hearing about all of those potential complications, I really want to end on this note. It's so important. The prognosis today is actually very, very good. With the right combination of treatments and really diligent follow-up, the vast majority of patients can control this disease and go on to lead full, normal lives. And that long-term care really does become a lifelong journey of monitoring. It means regular blood tests for IGF-1, periodic MRIs to keep an eye on things, and just ongoing screening for any of those potential complications we talked about. So when you step back and look at it, acromegaly offers this incredible window into the raw power of our endocrine system. It shows how the overproduction of a single hormone from one tiny gland can literally reshape a person's body and their entire life. It really makes you wonder, doesn't it? What other powerful biological forces are at work inside of us just waiting to be understood? Thanks so much for watching.